You are caller number 2 in the queue. Please hold.
It's not usually the greatest start to the morning when you hear that hold music, but the Health Ministry is trying to make the PCC appointment process clearer. The appointment guide outlines the numbers to call when booking, changing or cancelling appointments. It highlights the times to call for same-day or advance appointments, as well as other PCC services.
There was lots of feedback saying that people weren't aware of how to book appointments, they weren't aware of the different numbers, they weren't aware of the different times in order to which in which they could book calls. So what we've done is that we've launched one simple booklet. That one booklet will have all the information that patients need.
The information has been put out there, but how are you finding actually accessing the service?
Every time I call at 8:15, I always get an appointment. I've never had a problem.
I've never ever been lucky enough to get anything below, like, your caller number 70. I wonder who gets number 1 or number 10 or even, I don't know. Not me.
I know that there can be many people in the queue, but I also find that it goes by very quickly.
If they're busy, they're busy. You can't really...
So how long did you have to wait?
15, 20 minutes.
Obviously, sometimes I have to try alternative days, but apart from that, I generally do get an appointment.
Lately, it's been much better when you call on the phone. They don't leave you waiting for hours.
No, it's okay, la verdad. Today I've got an appointment in 2.0 seconds. But the waiting time has been horrendous, la verdad. Waiting for an hour to see my doctor has been, yeah. But the appointment system, it's okay, it's better than before, la verdad.
And whenever I try book an appointment, there's never any appointments to book, so it's always fight for the phone, wait 20 minutes on the phone whilst you're in the queue, and then get a doctor that doesn't really work for you.
I do think it's straightforward, but I think if you can't get through on one number, then it can be a little bit difficult to then, find the right alternative.
The announcement builds on the results of an open survey on patient feedback, which ran through September. 181 people offered their views on the PCC in areas including overall satisfaction, cleanliness, appointment access and waiting times. Respondents had to scan a QR code and opt to take part in the survey.
We advertised it as widely as possible. We made it as widely known as possible that there was indeed a survey available, and this was a response. If more people would have liked to do it, then they could have done so. But I personally think that it is a good snapshot.
Offering options for cancelling has been a particular focus.
If somebody doesn't show up, it means an appointment less. So if for whatever reason a patient needs to cancel an appointment, they now have 3 different ways that they can do so. And therefore, if I have a cancellation of the day, somebody else rings, somebody else can come and see me.
The publication forms part of wider efforts to improve the patient experience across the health authority.